Welcome everyone, and happy National School Nurse Day to all the nurses joining us. We're so grateful for everything you do to keep students safe, healthy, and thriving. So thank you. I'm really excited for today's conversation on supporting the whole child. At August Schools, we see day in and day out that student well-being is truly a team effort. And if you're not familiar, our platform brings together the whole student support team: nurses, counselors, athletic trainers, learning specialists, leadership, so they can collaborate, document, and use data to better understand and support their students. It truly takes a village to provide that kind of care that helps students succeed. And that's exactly what we're here to talk about today. So we have an amazing panel of school leaders who have been incredibly thoughtful and intentional about breaking down silos and building strong connected systems of support. So I'm excited for you all to hear what they have to share. So with that, I'll hand it over to our panelists to introduce themselves. Michelle, want to kick us off?
Sure. Hi, everybody. Welcome. I am Michelle Hershey. I am the Director of Wellness at Loa Country Day School. So we are on the West Coast. We're in San Diego area. Happy to hear from all of you. On our team, the wellness team here, we represent the counseling and nursing staff. So we'll talk a lot about kind of the connection between those two, and happy School Nurse Days for everybody that's here.
Hello, my name is Karen Gomez. I'm the Director of Wellness and Student Support Services at Cranbrook Schools. We're in Bloomfield Hills, Michigan. We are a pre-K through 12 school. We have day students, and then in high school or upper school, we also offer residential programming for students as well. So we have day and residential students. We have about 1,600 students in total. And this is shameless, but I think two of the nurses are on from Cranbrook today. So I want to do a big shout out to Amy and Leanne. Happy Nurses Week.
Hi, I'm Allison Reddington, and happy Nurses Week and Teacher Appreciation Week. I work at Ranney School, and we are in Tinton Falls, New Jersey. We're very close to the beach, the Jersey Shore, and we're outside New York City. We are 3 years old up through 12th grade, and in total, we're about 800 students.
Wonderful. So I'll get us started with the first question that I'd love to ask you all. So we have this webinar topic of supporting the whole child. So I wanted to ask, what does supporting the whole child mean to you and your school?
At Cranbrook, and I know we've been hearing more about the whole child since the pandemic, but really supporting the whole child model that I think originally came out of like ASCD has been around for a long time. And I think the pandemic helped a little bit people that weren't thinking about the whole child to start thinking about it more. But, it's kind of a philosophical approach to education that emphasizes more than academics, but also holistic development and well-being of each student, right? So I think it recognizes that kids learn the best, which is really a core mission of all schools, when they're supported and healthy and safe. So it's bringing together health, that's our doctors, our nurses, our counselors, emotional and physical health, well-being. A supportive school climate is essential as well. Even if you're helping people, the climate and culture is critical. Also, the cognitive development and social development. When we're paying attention to all of these things and working together collaboratively, that's what I feel supporting the whole child model is. And August Schools has been really great for us anyways in trying to link all these features and get better at communication and systems, because we all know that one thing we don't have at school is enough time.
That is true. Yeah, I would just to add to what you were saying, I think that schools, our motto here at Country Day, and I should have mentioned we're pre-K to 12. We have about just shy of 1,200 students. And it's sort of the artist, athlete, scholar of character. And to me, I think that's an amazing pillar and a goal that we should have for all of our children. And I see wellness and supporting the whole child as that base, that foundation. So if they don't have all the things that they need, if they're not well, if they are not taken care of, if they don't have their basic needs met and everything in between, they're not going to show up to be that artist, athlete, and scholar as we want them to be. So to me, it's such a foundational component of anything. And it's so fascinating to think when we think about like the output of what we expect our children to graduate with. It's often not talked about even now, even though it's becoming more and more prevalent and more, front of mind for a lot of people. It doesn't necessarily get the same space. So I think that in general, the whole child to me means that we and our teams support kids so they could show up in the classroom and do everything that they need to do so that they can launch into the world.
Yeah, I mean, just to echo a lot of what's already been said, at Rani School, part of our mission is to know and value each child. And I think that means knowing the whole child and meeting them where they're at socially, emotionally, physically, and intellectually. And then stretching them as far as we can take them with all the information that we have about their experience and their relationship with school and with peers, and building frameworks that differentiate for where each child is at, and acknowledging that development is a huge piece of that for us here. There's a huge range, even in kindergarten, just based on like the month that they were born in. And so, building programs that meet the needs of lots of different kids at lots of different stages. We're a responsive classroom school. And so the belief that being physically and emotionally safe is like the foundation upon which everything else is built. You can't focus on a math lesson or a literacy lesson if your head space is somewhere else. So I think the whole child encompasses meeting kids where they're at.
It also made it into our mission statement, which is amazing at Cranbrook. Our revised mission statement has it front and center, the well-being of students is our mission.
I love that. That's awesome. It's cool to hear sort of how different schools are approaching and how it's so embedded in like, so the values and the mission of the school. And so my next question is sort of, I think definitely for me, and I'm sure a lot of people since COVID have sort of grown in their understanding of that connection between physical and mental health. And I think that's really evolved over time. So I'd love to hear sort of how your understanding of that connection has evolved, especially in your roles.
Sure, I can jump in. So, I think I speak to all the counselors on the call, all the nurses on the call, all of us that have been doing this work for a really long time. I've been a counselor for 16 years in 3 different states, all across the country, mostly specializing in adolescents, and now leading this phenomenal team here at Country Day. And what I will say to all of you that already know this is we've known, if you've been in this field for a while, we've known how connected this is, right? We've been talking as counselors to our nurses about the tummy bug in the nurse's office for years. We've known that the challenges our kids face show up in different places and spaces, and that all of these things are really like the whole picture of a child. What I will say though is while we've all known that, I don't know that schools have always caught up as fast as we would like for them to. I think it's still fairly rare for, despite our knowing the connection, for that to be a cohesive team that's really working together, that has a unified goal, that really is de-siloing that information very thoughtfully. And while I think there are so many amazing people out there and probably even on this call that are doing this work every day, I don't know that the eyes of the average parent, they've connected this as a wellness piece quite yet. And so I think we still have some work to do to make sure everybody knows kind of just what that means and what that means in a school setting and what does that role look like. And now, specifically on our team, we have really been able to unlock the power of the data that we've been able to collect because our health office, because our counselors, and now really our administrators and more are using this platform. It's really opened up so many more possibilities for us because from my perspective, the number one ultimate goal of schools when it comes to wellness is prevention. We know that when you have an ailment, when there's a condition, something going on with your child, that you go to an outside support, doctor, a clinician, a therapist, whatever it is, and you go seek those resources, which is amazing. And we've done so much as a society to reduce the stigma to do that. What I see, especially as a campus from 3-year-old up through 12th grade, is that we have them when they're so little. We have them before. We have them before some of these things start to happen. So if we use the data of where we're at to backwards plan on what they need now and early, that's where the magic happens.
I would just add on, that was what Michelle said. I echo 100%. And, you know, I've been in this a while too. And as an educator and also a clinician, I've seen this evolve. And I do see parents as more connected a little more as well. And there's some other questions later on, I think, that speak to that. But still, we want everyone to be well, but then we also want them to get straight A's and go to Harvard as well, right? So even though when we understand those things, like sometimes there's a rub with it as well. You know, I think my role has really been, you know, as the first wellness director at Cranbrook Schools, is trying to bring stakeholders together, helping them see connections so that we can work together to provide the kinds of supports that students need and deserve. And I would say that it's just not for the students. I think it's for the faculty and the staff as well. I mean, the research is clear. So everyone knows about the research. I mean, it hasn't been just happening for the last 5 years. Like, we've seen an increase in emotional and mental health difficulties over the last 15 years, like that we've never seen in the history of keeping records. And Cranbrook also keeps its own data. So we, again, looking at that data, not just our opinion, you know, what is it that we're going to need, but as it relates to our faculty and staff too, when you look at the high rates of burnout and, you know, some of the work out of the Robert Johnson Wood Foundation, you know, we want to keep our teachers. It's a lot of investment. So we want them to do well, you know, in addition to the students. And I think when we're getting together in groups, looking at data, you know, talking about what's going on and how to best, like, what's the just-in-time thing that adults need and students need as it's related to their well-being, you know, this physical, mental health connection, you know, everyone matters. And I think it's a system that we have to bring all the stakeholders together, and relationships are a key thing to that.
Yeah, I love that, of just sort of bringing everyone together sort of with this common mission. And so I'd love to sort of ask how you all facilitate that collaboration. You know, it's tricky. Everyone has, you know, a lot to do, you know, little time in the day. So how do you, you know, make that easy for people to come together, for nurses, counselors, and other support staff to collaborate?
It's really tricky, but I will say that August Schools has helped us. We work on a 6-day cycle, and so we have tried to carve out time when we are planned to all be available and we can, you know, meet in person on campus somewhere, but that doesn't always work. And August has really helped us stay connected in ways where we can tag each other on messages. We can, you know, print reports and look at data and then find other ways to reconnect. But it's all in support of that, you know, whole child, so that the counselor, my learning specialist, the health office, the administrators, and when appropriate, you know, classroom teachers are all getting connected, at least online, before or in support of what we're doing in person.
Yeah, I would agree. Time is always hard, right? Like, that's the most challenging thing I think all schools face, is we never have enough of it. Even now, I just ran into a teacher who was like, I'm so ready for summer and I can't believe we don't have time. We need 6 more weeks, but I don't actually want 6 more weeks before summer. So it's that sort of push and pull that we experience in schools all the time. In terms of like how the workflows work, I mean, I think the idea of having the information all in one place helps us communicate in between those spaces when we don't have the time to connect, and in a different sort of way. And then also help us when we are able to come together to use that time really effectively, so that we're able to look at some trends, look at some things, whether it's for a specific student in support of that student and family, or the entire school, or a grade level, or whatever it is. We can sort of be really strategic with what we do, what interventions we provide, and what probably is most needed. because the data doesn't usually lie, right? It tells you what some of those tension points are in a school year and helps us kind of de-silo that information. And the power of having it in one place, that when we do come together, like I said, it's ready to go for us, is really just a game changer.
I would agree with what everyone said. And, not just having data, but like creating systems to use the data. Cranbrook is a really large place. It's 350 acres. There's a lower school, 2 middle schools, and an upper school with 2 campuses in the upper school. And, it's not that people weren't always doing good work, but it's just like we were all doing the work differently, right? If that makes sense. So, using data in, through August Schools and our other systems, it's a way to ensure that, students are having a good experience or similar experiences, that things would be this, certain things they could depend on as they move forward. And that's hard because sometimes people like the way we're, maybe they've been doing something, even if, it might not be bringing the results that they want. And another thing, I think, in addition to like student support meetings and care team meetings, and some of that is very linear at Cranbrook, and there's still things that we're trying to work on to streamline. But one of the main things I think that's so important is that it's a portal where things are safe. Like, we've all done it accidentally, like copied someone an email we didn't mean to. And I feel, having a system of collaboration, it's great in person, but when we're electronically communicating, I really feel the connection that August Schools gives us to tag each other or, share data in ways like within a protected system.
That's awesome. Yeah, so happy to hear it. And then that sort of, you mentioned sort of the families as a stakeholder early on. So I'd love to hear a little bit more about sort of what strategies have helped you engage families as part of these conversations about physical and mental health.
I would say one thing.
Go ahead, Michelle.
One thing is that traditionally speaking, I think counselors, mental health, even nurses, we often focus on like what's wrong, right? Something happens, then we have a reach out, or, we sort of address things and triage it as it comes in. And to a certain extent, I don't think our jobs will ever be removed from that. That's just part of the nature of it all. And we were all joking of like, what are the odds that none of us get interrupted in the next 45 minutes? I'm not sure, but that's sort of what we all know and love about our jobs. And as far as I'm concerned in engaging families, I think what families really want is tools. They really want to know, how am I going to respond differently this weekend because XYZ is coming up for me and my family. And so I think that when we are able to use some of the data that we're pulling to be able to think thoughtfully about programming for families and which points of the year and which grade levels we see certain things coming up for us each year, that helps us really plan. We have a really robust parent education series where every month we have a different workshop, all with this same idea in mind of like, whatever the topic is, whether it's have a healthy relationship with technology, your friends, your family, peers, yourself, any of the things. Parents want to know, like, what do I do? Like, I know it's important. That's why I'm sitting here and I gave you an hour of my very busy day. How do I say this? How do I phrase this? What if my child says this? So I think that one of the ways that we've been successful in engaging our families is helping them see us outside of the context of what's wrong, but really in the context of how we can help early and often. And it leads back into that same model that I talked about in terms of prevention. It doesn't have to wait until it's really big and huge and overwhelming. We want to help early. We want to help often, and we want to help prevent some of the things that start to go a little bit south when it goes a little far down the line.
I would echo everything Michelle said. At Cranbrook, there are counseling opportunities as well, for learning and workshops. Something that we also do, we collect student data in a survey called From Authentic Connections. This year we're doing the High Achieving Student Survey, and we also do a parent survey. So we've been doing the student survey for a while, and the parents are like, what's going on? Why aren't we doing the survey? So we're doing it with the parents as well. And we have a cross-campus parent wellness team at Cranbrook, and they are a group to be reckoned with. I mean, they want to be heard, they want to engage. Parents, what I've really learned from working with the organized parent group, and we have all kinds of other established parent groups, is that parents really do want to be included. Like, they are super interested. Like, we have to find opportunities and system and ways to engage them. So through our survey data, the parent survey, they create the custom questions. We get together, we analyze data, and then they kind of come up with, like, big ideas of things that they want to, like, engage the school with to help improve well-being for students. It could be for faculty, it could be for families in our community. So kind of getting a data point with them. And I know schools do all kinds of surveys in other ways as well. And we actually do other surveys with parents in addition to the more formal one with authentic connections. But, again, having all kinds of different opportunities for parents, whether it's like through parent organizations, like maybe that counselors might do quick topic talks, or, speak on something parents are interested in hearing, but parents really do want to get together and they do have a voice. And I think when they're involved, things always go better.
Yeah, I want to agree that when parents are involved, things do go better. On the flip side of that coin, sometimes we had Michael Thompson come to our school 2 years ago, and he talked about how schools often use that word partnership, and it can sometimes be misconstrued by parents because partnership suggests that there's like this 50-50 relationship. And when it comes to what's happening in school, we're really the experts about that. They're experts about their children and about what's happening at home. But at school, we need to present as the experts and the one who are, collaborating, but driving what happens here at school and how we can best put the student on the right path. And, some of the data from August has helped that. I have a community of parents who, like, their primary focus, they're making an investment in sending their child to an independent school in a suburban area where, like, there's lots of blue ribbon public schools. And so the academics for their certain families are the primary concern. But when I can pull up data about the number of visits to the nurse's office or the counselor and talk about how that may have an impact on academics, it has supported treating the whole child in a way that I would have had a more difficult time getting there, I think, before using August schools.
That's awesome. Yeah, I mean, the analytics to me is just the coolest part about August schools. And I know, all of you have mentioned using that data. And so I'd love to hear, sort of more tactically for the schools listening, how do you use that data to understand trends and sort of inform the interventions that you take?
Well, we're still learning and growing all the time as it relates to using it and the data. And we're trying to get other stakeholders. So obviously the counselors are in, the nurses are in, our athletic trainers are in. Finally, all the administrators are also in. We also have our school safety, all of our school safety reports now also in August schools. And August also created custom forms for us, which is really great, which they'll do. I shouldn't oversell, right? You guys are gonna get all these, like, do this form, that form. But what's great is that it has all these forms in the browsers, and then you can create things that are very specific to your school as well, right? So as we get more and more stakeholders in, I think, the possibilities are endless. Some of the ways we've been intriguing administrators is showing them analytics, right? We can pull up encounters, in different areas or things that are tagged and say, we had 740, visits to counselors and, emotional health or, different specifics, which can help guide all of us, right? In terms of, if it's staffing, services we're providing, and, bringing all the stakeholders in to use their portal, but also be able to connect them with a note they might need to see, can also be really helpful too.
I guess I
just to quickly echo Karen, we've used the analytics as well for programming and for staffing and analyzing, what do we need and what children need, and how do we get them ready.
I'll agree with all of that. We've done those things as well. The data has really been a very helpful driver to support the program. And just to give like an example, I was thinking of like, what's a tangible one I could share with you all that we've done. Anybody that works with seniors in high school will not be surprised to hear that we had a huge spike of social emotional visits the first week of November. And why do we think that is? I think you know, right? Application deadline, they are head in computer, getting it in. And then once that's done, they feel all the feelings associated with the stress that they just experienced. So, you know, I've known that working with adolescents for so long, but it was really eye-opening just to see in data form how significant this spike was in comparison to other parts of the year. So this year, knowing that, I had therapy dogs in my office November 2nd all day, right? And seniors just came, they hung out, they laid on the floor, they had a snack, they snuggled with a puppy. It's sometimes little things like that that you can do that doesn't take that much time. There was, you know, one day where I opened my office to dogs, which was really no hardship for me at all. And, you know, our kids really reported just have that moment where we acknowledged what they had been through and gave them time to just step out of class, take care of themselves, and that we know that this thing that they had to accomplish in the last few weeks was sort of inevitable and important, and we still care about you and how are you doing. So, you know, there's little ways and big ways you can use the data, but that's just an example of a little one.
I absolutely love that example. That sounds amazing. I've got a little puppy right here behind me, and they're very healing, I will say. That's awesome. Yeah, I remember hearing from a school who noticed that there was a big spike in visits to the counseling office right after winter break, that, you know, students were having trouble with that transition back into school. And so it helped inform for the next year, you know, what can we do before students go on winter break to sort of help with that transition when they come back. So I always love hearing the stories of how our schools use that data. That's awesome. And so I know we're getting close to time, but I wanted to end with one question. I know we have a lot of schools listening who are curious to sort of hear advice on how to actually make this happen. So what advice would you all give to a school that wants to start integrating their physical and mental health supports, but they're not quite sure where to begin?
I might just throw out there to kind of do an autopsy of like what's going on right now at your school. No one ever is excited, like, let's add something else to our plate, right? So sometimes there's things on the plate we might need to move off the plate. Like, look at areas that maybe overlap, where maybe you're duplicating work, thinking about what your real needs are, you know, your quantitative, your qualitative data, you know, just look at that data, sit with groups, like get curious, like, are there systems already or not? What is it that the data is kind of saying your students need or your school needs or your stakeholders need? And then, you know, kind of alignment. So that's where I think August schools can be really helpful is, you know, everyone says they like systems, but you know, that's not always true. Everyone kind of likes sometimes doing things they like to do as well. But I think if you just kind of work together, you know, building your relationships with each other and, you know, making sure you understand what your current reality is and then looking to make a better reality. And one of those things might be to have more integrated systems to reduce the amount of time and meetings you might be having, in addition to lots of maybe unnecessary emails and back and forth in that manner as well.
I agree. I think that's such a huge piece. Figure out what you're doing. There's likely people doing things you don't even realize they're doing it. There's always that classroom teacher that has this amazing SEL program that somebody just doesn't realize is happening that we can build upon or things like that. So I would figure out exactly who's doing what and where. And also just to add onto on another layer, I mean, talk to other schools, see what other people are doing, visit other sites. This is work we've all been doing for years. And if there is a specific need that you have that you're like, hey, I really got to build out my advisory program or my health curriculum, or, you know, we've got to work on this parenting series, whatever it is, people have done it. So I really encourage use the community, whether it's the August schools community or even just in your area. There's a lot of people in my experience of the years that are just a wealth of information. Have your teams visit other sites, like just always be learning and always be growing from each other. And I think we all have a whole bunch of wealth of information in our heads that we can share about things we've done and maybe things that we wouldn't do again, which is all good to know.
Yeah, I'll say too that a lot of work was happening in a siloed way, and sometimes centralized. It would come to like the office, to the principal or the vice principal, but really creating a team where all the stakeholders were represented and taking time, like opening meetings at the start of the school year. And we wrote a mission statement for our student support team and a vision statement for our student support team. And we reflect on that, and that guides a lot of our work. And I thought it was a really meaningful exercise for us as a school.
I love that. That's awesome. Like we talked about sort of alignment, everyone's sort of on the same page. That's so awesome to hear. So I was gonna say we've saved some time at the end for questions. So if you have any questions, feel free to throw them in the chat, and then we can go ahead and get them answered. Thank you for whoever shared the information. Oh, perfect, about the speakers. So yeah, we'll stick around here to answer any questions. But if you've got a student who came into the office, no worries. The recording will be sent out after the webinar is over. Awesome. Yeah, and I will say I was just reading about sort of like making space. I saw somebody commented about sort of creating a physical space for people to come together and collaborate. And I was just reading something about a nurse who realized that her school was having sort of a student support team meeting that she didn't even know about. And she had all this insight about students to bring to the table. And so it's also just sort of about making room at the table, making sure that, everyone who's got something to say and insight to offer is at that table. So I love hearing all this from schools. Oh, wonderful. I'll give it a couple more seconds if anyone has any questions, but if not, we'll go ahead and call it. Oh, we had one come in. Okay. Jacqueline is asking, if you had to choose your single greatest well-being initiative for students at your school, what would it be? That's a tough one.
Wow.
I can say at Ranny School, we had a lower school counselor who was sort of on call for teachers to go to for advice. And she would see students for check-ins and work with families and make referrals for outside. But last year she adopted the zones of regulation curriculum, and she now visits each classroom 3 years old up through 5th grade once every 6 days in our 6-day cycle. And the classroom teacher stays in the room and does the lesson or follows along with the lesson and supports what the counselor's doing. And I feel like it's made a big culture shift for us.
I think I might just say counseling and nursing really, but just working so intentionally to kind of destigmatize getting help. I was just thinking this year in the upper school here, the counselors, kids get activity credits and they need these to graduate, and they have been on a campaign. We want kids to be well, why can't they get an activity credit? So they're actually doing a whole lecture series. Some of it's in person and some of it's online. And students have signed up and they're so interested and engaged in it. And I don't know that that's the biggest, best thing, but I think as we just work together, with our students and faculty and what we can do in our spaces, I think when we start destigmatizing things, even things that we used to do seem to be better. So, just kids, it's okay not to feel okay. And, coming to the workshops and joining peer groups and wellness. We also have a wellness student groups as well that operate and kind of come up with their own mission and activities they want to do to improve the experience. So that's a tough one, but I mean, that would be one that comes to mind for me.
Yeah, I can jump with that in mind because I agree with what Karen just said. I think destigmatizing getting help is really important. And one of the things that we found really transformational is that while they will sometimes hear it if adults say it, they will much more likely hear it if their peers say it. So we have a flex time. It's kind of our club time during the day. of our mental health education group. They've been around for a couple of years. They really built momentum over the last few. And so it's upperclassmen that go in and actually teach lessons in the health class for the ninth graders and sometimes even for the middle school, talking about like, what do I wish I knew, how to destigmatize mental health, how to get help, what they've done and what's helped them. They have a mental health day on campus where it's really visible and fun, and there's no homework that night. They've moderated panels for their fellow students. So they just moderated a panel from a few alums that talked about transitioning to college and mental health on college campuses. But anytime we can get youth voice in that and they can lead the charge, they are so much more likely to listen to one another than they're going to be to us. So, and it's such a benefit for the kids that are gaining those leadership skills, and for all of the ones that get to listen and, learn from the advice their older peers have. So I would say peer-to-peer connection and youth voice is such a wonderful tool that we all have access to.
Oh, that's great. Those are great ideas for panels. I love that. And then Michelle, I think you touched on this a little bit, but Missy is asking about how do you structure time for wellness, when and where?
Yeah, so we have a health and wellness class. So we have a health class, but it's really intentionally health and wellness because it's a little bit more outside of the traditional scope of what you would think of when I think about my health class in high school. And so we have a couple of touch points for that in 5th, 7th, 9th grade. And then we also just have programming throughout, sprinkled in, whether we push into classes, whether teachers are doing some things, whether we have programs where the parent and the student comes together after school and learn something. I did like mental health first aid piece for our juniors. So we really kind of try to be responsive, use the data of what the students need in the years that we do, while also having sort of like our core place where we make sure we always are touching on topics and can scaffold it in the way that we need to.
Awesome. And then we have one, it looks like our last question. Katie is asking, saying, we would like to develop our nursing office into a health and wellness department. That sounds awesome. So we want to be in classrooms more for education and offer wellness groups. Can I ask how your schools developed this? What extra education did you need? And what qualifications do your wellness directors hold?
I mean, the wellness director thing, I was just typing an answer in the chat. There's a national group that meets every month. And when I first started here, it didn't seem like there was many people, but now the group is getting bigger and bigger. At NAIS this year, there was a whole strand, for wellness. So that was really great. In our national group, and it seems like there's a lot of different backgrounds that's represented. It does seem to me like there's a lot of folks that have like social work, psychology, counseling degrees, some, educators as well, like health educators. I have a master's degree in education and a master's degree in social work. But it seems like there's people like me that have mixed backgrounds in education and clinical work. So the backgrounds seem to vary. I've seen job descriptions with lots of different kinds of foundations. I guess it might depend if the wellness director is doing like mainly like a lot of health curriculum. Maybe they're looking for somebody with, educational background in that area as well. Just depends what kind of services the schools might be wanting a director for.
We had this magical thing happen this year where we had the opportunity after a beloved nurse retired to look at hiring, which is such an impossible position to have healthcare for the school. Like a nurse is such a key role. And the person we ended up being able to add to our team had been in the classroom for about a decade or so, and then became a nurse practitioner. So really married the two. And we're honestly still just tapping the potential of what that can look like, but she's phenomenal. And this idea of getting out of just the office, which could be hard, especially during cold and flu season. But, she's been helping teach puberty, helping with other things that she can have from like the educator and the healthcare lens. So I love the idea of that health and wellness center for the nurse's office. That sounds amazing. And, I can't speak highly enough for the model that we have here. I found it to be so immensely helpful with the counselors and the nurses being together on a team. I think it's really transformational.
We have room to grow with real estate as it relates to bringing those things together. We do in some buildings have more of like a layout where the nurse could be near a counselor. Other buildings, it doesn't work like that. So we keep fighting for some real estate to make things better as well. One of our nurses is in a copy room, and I'm not proud of that, but we're changing that.
Wonderful. And then we had another question. Sherry was asking, I realize we want to be proactive, but what have been your best practices while responding to a mental health crisis? And I saw that Lisa actually responded with sort of a helpful curriculum, but in case you all want to answer as well.
We've done a lot of systems work in the counseling team to actually define what crisis is going to look like, because we all think we know, and then a crisis happens and like we don't know, right? So we have, like documents that are go-to documents for all stakeholders, and actually they just got revised and they're with our leadership team right now for next year, but there's actually just like visual graphics of like what we're doing to make it easier so you don't even have to read tons of words. I saw Lisa's comment about Prepare. We're a Prepare school, so it's a ginormous kind of curriculum, but we all went through the training, the first and second day training, and we've taken that at Cranbrook and kind of created like our own go-to documents. Like we've changed Prepare to say Cranbrook Schools, so if something happens, like we have the go-to document immediately, and we have our own scope and sequence about how to intervene like during the crisis, and then kind of after the crisis, and the tiers of support kids might need in terms of after a crisis situation, and the psychoeducational components as well.
I would add, if your school doesn't have a crisis team, or I hope they do, I think they probably do. If your school does not have a wellness representative on the crisis team, then there should be one. Because the bottom line, if something were to happen, and heaven forbid it do, in any of our schools, but life happens, you're going to want somebody with the lens of how to prevent trauma, how to, triage, students that might need support. What are some of the best practices when we reunify kids with their families and everything thereon after? So I would start there. If that's a place that you don't have right now, make sure to advocate that someone with a wellness lens and background is on that crisis team. And from there, you can start building out your program. And I echo Prepare 2 particularly is fabulous for mental health practitioners on a campus to be able to really think about how a crisis would unfold, what people would need, and how you might sort of start, supporting students and families in a really difficult moment.
Nurses and counselors are also on, each of our schools has a safety team, and nurses and counselors are just members of those teams and have had that training as well, along with other strategic people. And we also have like a macro team, like you can call on to bring other stakeholders in if needed.
Awesome. Well, thank you, everyone. I know we're just about time. So I want to give a huge thank you to our panelists for taking time out of their very busy days to share their experiences and their thoughts with you all. And thank you to to everyone who joined today. Thank you so much for joining us and sharing in this discussion about this important topic. So I've shared a link here in case you want to learn a little bit more about how we support schools who are wanting to support the whole child. And so with that, hope you have an absolutely wonderful day and a wonderful week. Happy National School Nurses Day. Bye, everyone.